Hello, everyone, and welcome to Frankly Speaking About Cancer, Making Treatment Decisions. My name is Kelly Kraft, and I'm Program Manager at Gilda's Club Quad Cities. And I'm lucky enough to be here with Tony Weeks. She's an oncology social worker with UnityPoint Health, Trinity, Moline. So I'm going to share my screen so we can get started with this wonderful presentation. I do want to give a heads up. There is a link in the description for an evaluation. It really helps us keep these presentations, make sure we're doing them well, and it helps with our grant funding. If you can, anybody who watches via Facebook Live could click into that link. It only takes 2 to 3 minutes to fill out and send it in. And there are some directions on how to do that in the description. All right. So Tony, can you see my screen?
I can.
Perfect. All right. So this is Frankly Speaking About Cancer, Making Treatment Decisions. So today we're going to talk about a lot of great things. I've introduced myself, and once Tony kind of takes over, she can introduce herself a little bit and talk about what she does over at Trinity. We're going to talk about some treatment planning basics and choosing your treatment team. We're going to talk about setting goals, some guidelines and pathways, some different treatment options, talk about caregiving for our loved ones who are joining in today, and have a little time for questions and answers. The Facebook Live people, if you're watching at all, just if you're able to chat in some questions in the discussions, feel free. We can make sure to get those answered at the end or whenever I kind of see them come through. So these slides are regularly updated and reviewed. So that's something that doctors regularly do just to keep these new and fresh. And this is just a little disclosure. This program is made and developed by Cancer Support Community. We have Cancer Support Community has final control over all the content. And just a disclosure that Tony and I aren't being paid by the people who paid for the content here. And here are some objectives. So what I want you to take away from this workshop is just kind of the ability and some tools to be able to get these things done. So learning how to recognize your treatment needs and how to respond. Learning how to be knowledgeable about your diagnosis and treatment options. Learning how to build your support system, advocating for yourself and figuring out what questions you need answered from your healthcare team. And then I'm going to give some information on caregiving and making treatment decisions for caregivers because they're part of that whole team as well. And then just being able to make the right choices for yourself. So a couple of tips for newly diagnosed people. If someone is watching right now and you've been diagnosed with cancer or a loved one has recently been diagnosed with cancer, it doesn't mean that cancer defines you. 3 of the best things that you can do for yourself right now is educate yourself about the cancer type and cancer, anything about cancer that is relevant to your life. Get some support. Now is the time when you probably need support more than ever. And try to have hope and courage. I know that's easier said than done, but these are 3 things that Gilda's Club can help with. Things like this for education. We have, our support groups and a sense of community that can help with that hope and courage. So just some treatment planning basics. These are things to bring up with your medical team, because if you've just been diagnosed with cancer, cancer is one piece of your life and one piece of your medical history, but it's not everything. So things that they'll need to know are things like your age, because treatment decisions may be different for people of different ages. And kind of your point in life. So that's where you are with family and work situation. Your overall health, do you have other health concerns, other things going on that cancer treatment might affect. And then your expectations for treatment, especially if you've never gone through cancer before, you might not know what things to expect, what might happen. Your available resources and support systems. So who do you have available at home to help out if you're not feeling well? And, you know, is your work situation, if you're working, supportive? And logistics, including transportation needs. A lot of doctors' offices and hospitals have awesome social workers like Tony and people who can help with some of those logistic things. So if you're having transportation concerns, financial concerns, they might be able to get you in touch with people who can help with those things. And cost. Cost is a huge issue with cancer treatment and insurance. So if those things are a concern, you need to discuss that with your healthcare team so that, you know, you can get past that. And then any additional questions. As you're kind of going through the first little while after being diagnosed, you're going to have a lot of questions come up, and that's completely normal. And I would suggest just writing those down as you think of them so that they don't just come in your head and then leave again. You want to be able to write them down so you can get that answer. So we kind of go with the empowerment approach to treatment decision making. So you want to set goals, and this is not just necessarily treatment goals, this is life goals too. So you have things that you want out of life during treatment and after treatment. And so you need to put those down on paper and get those in your mind so that your cancer treatment can get you toward those life goals. And then you need to plan a strategy for each goal. And this isn't something you have to do alone. You know, you have your support system, you have your treatment team. So these are things that you'll do together with them. And then you'll find resources. So this is your treatment resources, but it's also all the resources around it. So thinking of, you know, how you're going to get meals if you're not feeling well, how you're going to get to your treatments. So making sure to have that kind of figured out as you're figuring out your treatment decisions. And then ask for help. You don't have to do everything alone. I know it's so much easier said than done, but usually everyone around wants to help. And so giving them something to do to help you is sometimes also taking care of those loved ones around you because they want to help so bad. So if you can give them a task, sometimes it really helps them and it helps you. And then you take action on these goals and these strategies. So shared decision making. Treatment decision making is shared decision making. You don't have to make these decisions alone. You'll have lots of support. You'll have your family, your friends, anyone who is supporting you through your cancer treatment can help you to talk through decision making. But it's also based on your relationship with your healthcare providers. So always having that open conversation with your healthcare providers about what's important to you, because everyone's treatment is going to be different depending on their life situation. So setting goals. So I'm going to go through a few different kind of life areas and talk about different questions that you might want to think about when it comes to setting treatment goals. So when you're thinking of different treatment options, maybe your doctor has laid out a few different options for what your treatment might look like. You have, you know, option A, option B, option C, and you have to decide between those and what's best for you. So the first thing you might want to think about is that physical, emotional, and sexual health and well-being. So what's most important for you to be able to continue to do? And maybe that's during treatment, maybe that's after treatment, but those things that are important to you to be able to continue to do, make sure that you have that goal, those goals set out so that your doctor knows maybe you still want to be able to travel. Maybe that's very important to you. Because if you don't have that set out, your doctor can't know. So anything that that is important to you, you have to make sure that that gets communicated to your healthcare team. And then family and social relationships. So what's going on in the lives of others that's important to you? Maybe you have young children. And so that's something, you know, being able to take care of them and be involved with them might be something that's very important to you. And then work, school, home. Do you need to continue working? Can you adjust your schedule and responsibilities to allow for the cancer treatment and any side effects you might be experiencing once you start? Are you able to get help for tasks at home? Do you have loved ones that live with or near you that can help? Do you have the means to hire help? Those are things that you would just need to think through while coming up with some treatment decisions. And so community involvement. Are you getting support you need from your community? Are you able to stay active and involved in your community? So this is, I mean, this could look a lot of ways. This could be, a community is a very vague term, but this could be your, you know, your workplace. This could be your family. This could be your neighborhood, your church family, any way you see your community. You want to kind of come up with how involved you want to stay with that. And if staying involved with that will help you morale-wise and also give you kind of a village to lean on. And then personal and spiritual growth. Are you taking of yourself spiritually and emotionally? So that's just something to think about, especially when it comes to like, if you're wanting to keep going with like, I went forward too quickly. Just trying to make sure that you're taking care of yourself spiritually and emotionally. Maybe you're not able to go, if you're a churchgoer, maybe not able to physically go to church for a little while, and that's okay. Especially right now, a lot of churches are offering things online. Maybe you can do kind of a small group thing. There are ways that if that's an important thing to you, to be able to continue to do that. And then any other goals or things that are important to you that aren't on this list. And so understanding your values. So this is basically the same thing we were just talking about, of just making sure that you have kind of even on paper, a list of things that it's important to you to do once you start treatment, things that you still want to be able to do. Some of those things might be, and this is, everybody's values are very different, but I value being active with my family might be a really important one to some people. I value being healthy to attend. This can be work, this could be church, this could be my daughter's wedding in 3 months. It's something that you're hoping to do and want to feel well enough to do that. Maybe somebody values having few side effects or the best treatment available no matter what, or being part of a clinical trial to advance science. Everybody is different in what things are important to them. So have those things down on paper so that your doctor can understand you and what's important to you. And just some helpful tips. Cancer journey has lots of decision points along the way. It's not, you know, just one fork in the road. A lot of times there are multiple forks that you'll run into where you'll need to make decisions. And just some helpful tips. Break it into smaller pieces, one step at a time. It doesn't need to be one big decision all in one piece. You can make little pieces of the decision. And then locate yourself in the process. Remember that you are a human, you're different than everyone else. Think about your goals, your life, and your current situation, and advocating for yourself and what you want and need. And then work with your doctor to create a written treatment plan. I think putting everything in writing really helps. It helps you have something to go back to when you leave that doctor's appointment. A lot of times there are a lot of things that happen in a doctor's appointment, and it's good to have things written down so that you can reference back to it. So when somebody is newly diagnosed, understanding your diagnosis is the first important thing you can do. So here are just some tips to fully understand your diagnosis so you have the power to go forward. You need to ask your doctor to tell you exactly what type of cancer you have and write it down for you. If you don't understand, because there are some cancers that maybe you haven't heard of. You know, we've all heard of some of the big ones, but there are some of the lesser known ones that maybe we haven't heard of before. And if you don't fully understand, you know, what type and stage of cancer you have, ask questions. That's what your doctor's there for. Ask for a copy of your lab report so that you can have those numbers and the wording that is on the lab report in front of you. Ask your doctor what they base their treatment recommendations on. And you can always talk to nurses too. They're a wealth of information. And then talk to other people who have had cancer, especially those with a similar diagnosis. That's something, if you don't have other loved ones in your life that you want to talk about that with, that's something that we have available at Gilda's Club. We have our support groups where people meet regularly right now via Zoom, who all have or have had cancer. And, you know, we talk about different things that we've gone through and you know, ask for advice and help and just have some camaraderie too. And some more questions to just ask about your cancer diagnosis. So, I mean, number one, what type of cancer do I have? Make sure that you have that answer to that question. What stage is my cancer and what does that mean? Some different cancers have different ways of staging. So knowing what your doctor means by that is really important. And then what symptoms of the cancer might I experience? Different cancers affect your body differently and depends on the person, but your doctor may be able to give you an idea of what that's going to look like. What types of tests will I need and why? You know, what does this test tell you when it comes to making my treatment decision? And where can I get a second opinion? It never hurts if you feel like you want to get a second opinion. That's always a great thing to do. All right, well, Tony, I will let you take it for a little bit here. If you want to kind of explain a little bit about what you do and then talk about choosing your healthcare team and how you're kind of part of that too.
Sure. So I'm Tony Weeks. I'm the social worker at the Cancer Center at Trinity Medical Center. And so I try and meet with all the patients that are starting either their radiation treatment or starting their chemotherapy. We make the dietitian, Christy, and I both make our best attempts to try and touch base with everyone so they at least know who we are and the different things we can offer them as they're going through their cancer treatment and beyond. Some of the things I help with include if patients have any barriers to care, you know, like Kelly had mentioned before, sometimes transportation or different things like that are a problem. If they have financial issues, worries about communicating with an employer, you know, trying to work through their cancer diagnosis, if they need support and whatever that might mean to them, if it's support groups or individual support or, you know, linking them up with whatever is going to be most helpful to them. And you know, sometimes finding resources for some of the more day-to-day concrete needs, you know, if they have trouble paying rent, trouble paying their utilities, just any and all of the above. And I can also help with advanced directives, the power of attorney and living will, which I think we'll be addressing later. So that's just kind of a brief snapshot of some of the things I can help with. So welcome everyone, and kind of moving on to my portion of it with choosing your healthcare team. You know, you probably know that's a pretty important part of going through your cancer diagnosis. And, you know, sometimes the choice of doctor depends a lot on what type of cancer you have and the stage, and whether you're going to be treated here, whether you might be going to a bigger institution like University of Iowa or somewhere like that. It can also depend on your personal preference, what insurance coverage you have, because unfortunately that does play a big role in who you can go to and what hospital you can be treated at. And then the logistics such as transportation, distance, and cost. I mean, not everyone's able to pick up and go to Mayo Clinic or go to University of Iowa, you know, depending on what resources you have. You know, it's one of the main things is it's of course important that you feel comfortable and confident in the person that you choose to care for you during this time and feel like you have a reasonable connection with them, that you feel like you can talk to them and that they'll listen to your concerns. It's also important to keep in mind that you can always ask for a second opinion, and that's one thing I feel like we're very fortunate. I do know Dr. Constantino and Dr. Vacalanca here, as well as the medical oncologists at Genesis Illini. They are wonderful about not taking it personally if you want to seek a second opinion. In fact, sometimes I think they encourage that because they want their patients to feel comfortable. So I think we're very lucky that way that our doctors in this area support that. Okay, next slide, Kelly. One thing about it too with a cancer diagnosis, there's many people that you're going to come in contact with, and some of the possible members of your healthcare team. That list is pretty long. I tell patients a lot of times you've probably never felt so popular in your life as you have now with all the doctors that you have to see. But some of the members of the healthcare team can include a medical oncologist, who is the doctor who manages basically your chemotherapy and your overall cancer care. The nurses, they're going to be taking care of you. We have some wonderful nurses here also at Genesis that can be your go-to person when you have questions or concerns. They can kind of be the front line that can help with those. A surgeon, if you're able to have surgery, can be the doctor that does the biopsies, but also the doctor who maybe is able to remove the cancer. We don't really have surgical oncologists here, but I think they do have them at some of those larger institutions like University of Iowa that specialize more in cancer specific surgery. Like a lot of times for women, if you have a gynecological cancer, they will refer you specifically to a gynecological oncologist who specializes in the surgical removal of that. A pathologist is kind of behind the scenes, and they're going to be the ones who determine what type of cancer it is and help with the staging, also making sure that that surgeon is getting clear margins for that cancer. And the radiologist is also a little bit behind the scenes. They're going to be the ones reading any CAT scans, PET scans, MRIs, and different tests that are done. The radiation oncologist is a radiologist who specializes in the delivery of radiation treatment. So they're a little bit more specialized than the medical oncologist in that they specialize only really with the radiation that's being delivered and see you during that period of time, but then do minimal follow-up after that. Dosimetrist works in partnership with the radiation oncologist. They help determine the dosage of radiation that you're going to get and how it's going to be delivered over the course of your treatment. The radiation therapist are any of you that have had radiation treatment, the girls that are on the machines or the gentlemen that are on the machines that are helping to set you up each day for your radiation and make sure that radiation is delivered in the way that the doctor intends. The medical physicist also works in our radiation department and helps the oncologist and the dosimetrist in determining that dosage of radiation, and again, making sure things line up correctly for the treatment that's delivered to the patient. And then, in addition to all of these specialists, you may still be seeing your general practitioner or primary care physician who's following you maybe for some comorbid conditions or other conditions that you have as you're going through your treatment. And a social worker. Hopefully you'll come in contact with a social worker that can help out with some of the issues that I just described earlier that you may experience. All right, Kelly, next slide. Additional members of the healthcare team include a pharmacist who will, of course, be making sure you get any prescriptions that are ordered and talking about any interactions that might occur with the different medications that you're on. Possibly a psychiatrist or a psychologist as you're going through treatment. A lot of times patients, of course, experience anxiety, depression, different things like that that are related to the situation that they're in with finding out that they've got a cancer diagnosis and the whirlwind that follows that. And so a lot of times the doctors are regular doctors or medical oncologists may prescribe medications, but other times it might do some good to see a psychiatrist or a psychologist who can do a little bit deeper dive into some of that and make sure that medications are going to be effective. I mentioned earlier a registered dietitian who can help patients if they just want to eat better as they're going through treatment, or for patients who maybe are going to have some real challenges in the way that they eat. She can be a great resource for that. Possibly a plastic surgeon, depending on if any kind of reconstruction is going to be performed on a patient following surgery that they've had. A rehabilitation specialist. We did have a rehabilitation specialist here at the Cancer Center, and unfortunately no longer have one, but when you're fortunate to have a rehabilitation specialist, they can help in doing exercises, instructing you on different exercises that can help regain lost mobility, help with stretches and different things that are considered safe, but can help in patients getting back to where they were maybe pre-surgery or pre-procedures or pre-treatment. Sometimes help with neuropathy and other side effects. So they can be a great resource as well. And then depending on if you need help in the home, sometimes home health aides can come in and help with basic activities of daily living. Hospice care providers may be involved, or clergy if you would like to speak with pastoral care or maybe someone in a church-related manner. So all of those can be wonderful members of the team. Next slide. Preparing for your doctor's visit, you know, sometimes that can be kind of a tall order, especially when you're going for your first visit, because obviously it's very important to write down questions before you go and take them to your appointment. But a lot of times, especially when you're going to that first appointment, you have no idea what your questions are or what you want to write down. And so sometimes that can be a little bit difficult, but just a matter of doing the best that you can to make sure that you're trying to get as many answers right off the bat. So write down the answers to the questions that you do have once you get that from the doctor. Don't record the visit without asking and talking to your doctor about it. Now, I do have to say that among the many things that COVID-19 has changed, this is one of them, because so many times recently, family members haven't been able to go into the doctor's appointments with patients. And so I think everyone has experienced, you know, during that initial visit and beyond, especially when the doctor is talking about your cancer diagnosis, it's easy to get fixated on something that's being said and miss the next 5 or 10 sentences that he's saying to you. And so we've always encouraged people to have that second set of ears. And with COVID-19, that's made it a little bit difficult to do that. And so a lot of times lately, family members have been FaceTiming their family members during the appointment so that their loved one can hear what the doctor's saying and ask questions, or recording it, or at least having them on speakerphone so they can hear. So that's one good thing that I think that has been happening. So, you know, kind of like the bringing a friend or family member with you to take notes, that's kind of taken the place of it here recently, I think. But also make sure when you go to that doctor's visit that you're telling your doctor and nurse about all the medications you are using, including anything over the counter, vitamins, supplements, anything like that, because all of them can truly have an impact. Okay, Kelly. So what you can do is try to stay focused on what is happening right now rather than trying to make all of the decisions at once. Like I said earlier, that whirlwind of everything. It's easy to think about the future, think about what you're going to do at your job, what you're going to do about your house, what you're going to do about everything. But just try staying focused on what the doctor is telling you, one day at a time, what you need to get done that day. As much as you can break it down, that'll help things go a little bit more smoothly. You can absolutely ask to sit down with the financial or insurance counselor at the cancer center. They can help you understand what the cost may be and a plan to pay for it. A lot of hospitals have financial assistance programs if that's needed, and you don't have to, I mean, they operate on a sliding fee scale. So, I mean, it's definitely worth finding out what they have to offer, what your potential out of pocket might be, so that you're not caught by surprise. And sometimes, you know, a lot of times have patients come in and bring bills in just so we can kind of review them and review their explanation of benefits that they get, because once they start coming, they definitely come fast and furious, and just kind of making sure that everything's getting billed the way it's supposed to be and that everything's going as it should. So, and understand that things and how you feel about them will definitely change over time. I mean, things are going to get overwhelming at times, but then you're going to have days where you feel like you're knocking it out of the park too. And that's perfectly acceptable and understandable. But make sure that you take advantage of available resources and use the resources and programs that are available. So moving on to treatment options. Well, making a decision is, sometimes one of the more difficult things too, and factors to consider and discuss with your doctor are, what are the goals of treatment? What are the potential benefits? What kind of side effects can you be expected to experience, and what's going to be the severity of those as best he can tell? I mean, a lot of times he's making his best recommendations and his guess is as good as yours, but he can give you some kind of an idea of what to expect. And, don't be afraid to ask the reasons behind why he's recommending a certain treatment for you. And of course, finding out what the costs will be. Okay, next slide. It's important to understand that doctors do use guidelines and pathways in determining the best treatment for patients. There's a focus on developing evidence-based standards of cancer care that can be standardized and shared among multiple hospitals and institutions. And it helps both doctors and patients make informed treatment decisions. Like, for example, here at the Cancer Center, we routinely use NCCN guidelines, which that is the National Comprehensive Cancer Network, and they specifically make guidelines based on a patient's diagnosis and proposed treatment that doctors can follow. The two basic approaches for developing the standards are called guidelines and pathways. So next slide. The guidelines, like specifically to the NCCN guidelines that I mentioned, are based on specific subtype, genomic profile, and stage of a cancer. They are developed by panels consisting of cancer specialists, experts in psychosocial care, and patients that help make these guidelines. And they're developed based on what's known to work best for treatment. They don't really take cost into account when developing these guidelines. They take into account what is considered best practice for patients in a given diagnosis in a given situation. So, all right, next slide. Pathways are a little bit different. They're shown to improve quality of care by ensuring that patients receive the most proven therapies rather than unproven and expensive ones. They include preferred drug choices, and in some cases, oncologists might receive financial incentives for keeping with these pathways. So they're a little bit different. All right, next slide. So questions to ask about some of these treatment options when you do talk to the doctor is, what is the goal of the treatment? Again, why are you recommending this particular treatment for me? What are the benefits and risks of each treatment? And how can we prepare for and manage the potential side effects as best we can? Next slide. How often will the treatment be given and where? Is it something I'll have to go to the infusion center for? Will I be going to the cancer center for radiation? What's it going to look like? And how is it given? Will I be getting an IV infusion or taking a pill by mouth? And how long will each of the treatments last? Chemo, for example, can last anywhere from an hour to 6 hours. Sometimes patients are here all day. And does the facility where treatment will be given also offer resources for emotional support or support in general? Some of the treatment options include chemotherapy, radiation therapy or radiotherapy, surgery, targeted therapy, or immunotherapy. We'll talk a little bit more about each of those starting on the next slide. Chemotherapy is a treatment that involves the use of drugs to destroy cancer cells. It can be given through an IV, in pill form, an injection, or applied directly to the tumor. And it's usually called systemic therapy, especially because it's going through the body. It can vary in dose and frequency depending on the type and stage of the cancer, so it's important to remember that. I think some chemotherapies might even be prescribed by weight, depending on how much you weigh. So the dosage, of course, can be different for each person. The next type of treatment, radiation therapy or radiotherapy. There's two different kinds of radiation therapy. External beam radiation is delivered by a machine, aiming high energy rays at a specific body area. The treatments are usually once a day for several weeks. Patients come 5 days a week, sometimes for 2 weeks, sometimes for 6 or 7 weeks. And they're only here for about 15 minutes for each treatment. It does not take long at all. They've really made some advances in the treatment machines, and especially over the years, and it's really cut down the treatment times to make it a little bit easier for patients. Internal radiation is a little bit different. In this case, the radiation is implanted into the patient's body through a method such as radioactive seeds, ribbons, capsules, or a liquid. Sometimes inpatient treatment may occur until the body no longer gives off radiation at a high level, but many times the radiation is implanted and the patient goes home same day. So it just depends on what type the doctor's recommending for you. On the next slide, talking about surgery. This is actually the most common form of cancer treatment, and it may be used alone or in combination with other treatments. So, at the diagnosis point for a cancer diagnosis, it's used in determining what cancer you may have. So as a biopsy or something of that nature. It can be used in staging to determine how the cancer is developed. It can be used in treatment to try and stop the spread of cancer cells by, like I referred to earlier, making sure there's clear margins. If a cancer can't be removed in total, they may do something called debulking, where they remove as much of the tumor as they can. Or in reconstruction, a lot of patients may have reconstruction to restore the function or appearance of a body part affected by the cancer treatment. Moving on to targeted therapy, it more precisely attacks cancer cells by targeting specific genes or proteins. So it also can be given through an IV, a pill, or an injection, but not all cancer types can be treated with targeted therapy. You have to have a specific gene type, or doctors may look for that, or some kind of a profile that fits the use of this targeted therapy in order to qualify for it. So that's why it's not necessarily appropriate for all cancer types or all patients necessarily. And just because they call it targeted therapy, it doesn't mean it's more effective than other types of cancer treatment. It's just another treatment option. Moving on to immunotherapy, it uses the body's natural defenses to identify, attack, and kill cancer cells, and it's usually given using an IV. It can be used along with other treatment options such as chemotherapy too, so it's yet another option for patients. Moving on to the next slide, some other options to provide support to patients, moving on from the treatment decisions and types of treatment. Palliative and supportive care can be a good option for patients who are in treatment. It focuses on providing patients with relief from symptoms, pain, and the stress of a cancer diagnosis. It can start at diagnosis. It is not the same as hospice care, which I think a lot of patients and even staff have had a hard time kind of wrapping their heads around that, because for a long time, palliative care and hospice care were almost considered synonymous in the same thing. But palliative care has kind of broken off from the hospice care. Its intent is to help patients manage their symptoms and give them relief of symptoms as they are going through treatment. They are a home-based program, can see patients in the home and work hand in hand with the patient's medical oncologist, radiation oncologist, or other medical professionals. This is not just for cancer patients. The goal is to improve quality of life for the patient and attend to the needs of family and caregivers. They can help in finding resources for patients. Since they're coming out to the home, they kind of get a firsthand view of some of the needs that the patient might have, or what might be most helpful to them in the home to kind of help them manage better. So it can just be a great resource, and one that can help patients as an added layer of support. Moving on to the next slide for questions to ask during treatment, because just while it's important to have those questions when you're trying to make that treatment decision and find out about your diagnosis and what kind of treatment you're going to choose, that doesn't mean you can't be asking questions all along as you're going through treatment. Make sure to let your provider know the symptoms and side effects that are affecting you the most, the ways that they are interfering with your life, and continue to ask what you can do in conjunction with the doctor to manage those symptoms. You don't have to suffer in silence. I mean, make sure that you're communicating with them and letting them know. So there's always options to possibly adjust treatment, or again, not that you necessarily want another medication prescribed, but they may be able to do that and alleviate some of the problems that you're having. You can always ask if complementary therapies like supportive or palliative care can help in managing the symptoms and side effects, and ask for a referral. Most of them are very willing to get things in place that are best going to help their patients. So moving on to coping with the side effects on the next slide. You, of course, may have side effects from your treatment. Make sure to track them, write down the timing of them, the severity, and how it's making you feel, or what you're feeling, and how they're impacting your life. And make sure to bring them up with your doctor. He's not going to think you're a complainer if you let him know how it is impacting you. And then more common concerns and important tools on the next slide. Some important tools to help with dealing with those include, like I mentioned before, the advance directives. Everyone should have one of these, honestly. In fact, all patients, at least it used to be the process at West Campus when I worked there, all patients are asked if they have an advance directive or a living will, and if so, do they want that to be put on file? So everyone should have one. But if you are asked this, it doesn't really have anything to do with your diagnosis. It just is giving you the chance to either complete these documents if you want them done, or provide a copy to us so we know how you feel or who your power of attorney is. A durable power of attorney allows you to name a person who will make healthcare decisions for you, or if you aren't unable to make them for yourself. They're called a healthcare proxy. The person does not need to be an attorney. In fact, it should be someone that you trust to make your medical decisions, or to have access to your medical records, or that can speak on your behalf if you want them to do that. So it's someone that you choose or designate to do those things for you. You also can control when they're able to speak on your behalf, because obviously, as long as you're able to make your own medical decisions, the doctors are going to come to you to do that. You'll be signing your consents. You're going to be making your own decisions, but this has someone waiting in the wings if it's ever needed. A living will or advance directive. Oh, sorry. Can you go back to the previous one, Kelly? Sorry. It lets your doctors know what kind of medical care you want if you cannot speak for yourself. So they've kind of changed those documents a little bit over time. And I know the power of attorney documents that we have here at the hospital that I help patients with, it's all in one. They're not two separate documents anymore. And so it combines the power of attorney for healthcare, where you name someone to make your medical decisions when you are unable to do so, and a brief statement about how you feel about life-sustaining treatment. Very brief. So they're combined into one document now, and it's very easy to complete. Okay, next slide. A financial power of attorney, a little bit different. And of course, that names a person who will make financial decisions for your home and medical care in the event you are unable to do so for yourself. Sometimes it's called a power of attorney for property. They don't allow us to do those here at the hospital. We can't have much to do with the financial aspect of things, but you can seek out the services of an attorney to do that. You can a lot of times get the documents online and witness them in front of a notary public, and they're just as valid, you know what I mean, as if you would go to an attorney, if you'd like to name someone to step into this role for you as well. A do not resuscitate form, or an allow natural death form, or I guess sometimes they call them a do not attempt resuscitation, is an order from your doctor that you would not like heroic measures to be taken in the event of a cardiac or respiratory arrest. we do have those forms here. They're called an I-POST in Illinois, an Illinois Physician Order for Life-Sustaining Treatment. Iowa has very similar forms. I am able to complete those if patients want those. You have to go through a training in order to be able to complete them. And they really can specify how you feel about not only CPR or cardiopulmonary resuscitation, but how you feel about being put on a ventilator, how you feel about artificial nutrition. And so you can kind of specify how you feel about those different things. But really, one thing they made very clear to us in the training is those aren't a form that just anyone should have or fill out, because they are intended to be a form that you would put on your refrigerator or carry with you. And if you would have an adverse cardiac event or something of that nature that would happen, if someone called paramedics, they're supposed to do nothing to help you. And so, for example, if you're going through chemotherapy, we've had patients that have had adverse reactions to chemotherapy, and it maybe have had to have a patient assist team called down just to kind of check them out, maybe give them a little oxygen, make sure things are going okay. So this is not something that, again, just anyone should have. This is something that is, requires pretty in-depth conversation and may be appropriate within a person's lifetime, but requires some careful thought. A will, of course, states who's going to receive your money and belongings and who will be responsible for your children if you have children that are minors. And that does require an attorney to go to kind of outline those things as you're setting up your estate and taking care of some issues like that, whenever that seems appropriate to do. And I think that might be the end of my slides.
Yeah, thank you for all that awesome information. I'll kind of take over for a bit here. I wanted to talk a little bit about caregiving. I know we've got some caregivers watching tonight, and caregivers are a huge piece of this team as well. And so first point is, you may feel rushed to make a decision about a loved one's treatment. It's a huge decision to make, and of course you want to get that treatment started right away because you love that person. But it's also important to remember to just slow down and take some time to think things through. Taking that little bit of extra time can give you a greater sense of control and kind of provide a calm presence, and that can help both you and the person who's going to undergo this treatment. Just take time to think through and write down and ask questions, think through the different steps, and partner with your loved one's medical team to develop that treatment plan. It's important that you take notes for yourself and for your loved one. So I know Tony was talking about taking notes and recording. I think that's really important if you're able to go to those appointments. Sometimes with COVID right now, loved ones aren't able to go, but we can record things and talk about them after. And comparing notes is super important after an appointment because there's so much information being thrown at you from the doctors and a lot of things that need to be done and decided. So maybe you heard one thing one way and your loved one hears it a different way, and you can talk about that and make sure that you're both understanding what's going on. And another thing that's easier said than done, but make time to take care of yourself and ask for help when you need it. Gilda's Club Quad Cities is open to not just the person with a diagnosis, but also our caregivers. We have caregivers who join in on our meditation and our yoga classes and our art classes and all of our fun things that can give you a little bit of pause in a day and give you something else to focus on with other people who understand what you're going through. And when it comes to taking the next steps, be selective as to where you find your information, especially this day and age where the internet is so easy to go to for information, but we need to be careful when we go to the internet for that. Use proven, reliable sources. Start with people and print material. The web, the web is great, and you can find a lot of information on it, but it's also you can go into a rabbit hole of misinformation and a lot of scary stories that maybe aren't pertinent to your situation. And then benefit from the experience of others, but remember that your path is unique. So that's something big with Gilda's Club too. We love to come together and talk about each of our experiences so that we can kind of gain collective knowledge from one another. But also know that just because someone maybe had a bad experience with this drug or this situation, you might not. You might have a completely different situation. And it might be very different for you. And choose a doctor, all of your doctors and your healthcare professionals. Make sure that you can trust them and feel comfortably openly communicating with them. If you don't feel like your doctor or your healthcare team is right for you, remember that you have rights and you're a consumer. You get to choose, and make sure that you have a doctor that you trust and can talk with. And if you don't feel like you can always look into other options. So here's some cancer support community resources. Cancer support community is provided us a grant to have this workshop tonight. And also they are our headquarters, and they made this wonderful presentation. So these are some great things that they offer just to have in your back pocket for both people who are diagnosed and our caregivers. They have a cancer support helpline that's staffed by professional counselors that you can call. They even have some weekend hours now. And so they would be available to give individualized, just like kind of help out if you're having a hard time that moment, but also resources. So financial, transportation resources, those tangible things that you may need. And then the Cancer Experience Registry, we'll talk about that a little more in a bit, but it's a community of people touched by cancer, and really ask some great questions to get data to help us develop things like this. And then open options, that's something that I really want to talk about for a minute here, especially when we're talking about making treatment decisions. This is a one-on-one program that Gilda's Club Quad Cities and most of our affiliates have available, where you sit with one of our social workers like myself, and right when you're about to make a treatment decision. So maybe you have a doctor's appointment coming up and you're facing a fork in the road. So maybe you're choosing, let's say, to have a lumpectomy or a mastectomy, and you have to make a decision. There are pros and cons of both options. Or maybe you're thinking of changing treatment halfway through. It can take so many forms, but you sit down with one of us and we really take ourselves out of it and get to the core of you and your goals. And so we write down your situation, your support system, and your goals. That's life goals, that's treatment goals, that's the things that we talked about at the beginning that are your values. And then you end with the questions that you have for your doctor. And once you get the answers to those questions, we'll work on that. We work on that list together, and you should leave feeling like, if I get the answers to these questions, I'll have the tools that I need to make that decision. And it really helps you feel like you're ready for that appointment. And it also helps the doctor know exactly what your values are, what you need in the question, and know the questions that you have. And then, frankly, speaking about cancer is what we have, what we're doing right now. So our Great Education series. So Cancer Experience Registry, just want to talk about this for a little bit. It's a research survey, and they have a bunch of different ones for different cancer types and caregivers as well. And it asks a lot of questions and gathers data about the emotional and social needs unique to the cancer experience. So it informs medical professionals about patient needs so they can improve quality of care. It informs things like this. They even use that data to bring to policy makers and lawmakers to show them what people who are impacted by cancer are going through and what they need. It's confidential, it's secure. It's just kind of a timeline of it, but it's a really neat way to kind of get your voice out there. It doesn't take all that long. You agree to an informed consent put your email in, make your profile, and then kind of fill out the survey. And there's a link in here on how to go through ours, so you they know that you're part of Gilda's Club Quad Cities. And if ever somebody is interested in advocacy, so that can take so many forms. We hear the word advocacy and it can sound a little bit scary, like I have to go talk to my senator, which is great, but advocacy can take a lot of different forms. And Cancer Support Community has a grassroots movement, which is a network of people who are interested in trying to make change to benefit people impacted by cancer. And if you go to, there's the link on the bottom of this slide here, and you can just find it on their website too. You can get on their mailing list to find different ways to get your voice heard and to make a difference. It can be, you know, little things like signing petitions. It can be writing letters to representatives. It can be going in person and making calls. But at any level of comfort you have with that, there's something that you can do to make your voice heard and to make a difference. And then another great resource is mylifeline.org. So Gilda's Club Quad Cities has kind of our own little one. And it's a really great tool for someone who's about to go into cancer treatment, and allows just like being able to give updates to your support system instead of having to, you know, activate the phone tree. You can put all your updates on there. You can actually, they have a helping calendar, so it can help you coordinate people to bring meals. Maybe one, you know that this week you're going to have surgery and you're going to need somebody to maybe bring you dinner on those days while you're recovering from surgery. You can, you know, kind of ask for them. People can sign up for helping with meals and rides and all kinds of stuff. You can kind of connect, have a discussion board on there. And you can also have family and friends kind of monitor the site and kind of be your proxy for this site, so you don't have to do all the work yourself. And I'm looking on Facebook. I don't see that there are any questions right now, but definitely want to make sure that I thank the Cancer Support Community for making this possible. And with that, I am going to end the Facebook Live. But for one last thing for Facebook, in the description of this video, there is a link to the evaluation that really helps us with grant funding and making sure that we're meeting the needs of you guys and that these are helpful, and to give us ideas going forward of what we can do to help you guys. So thank you for tuning in, and we'll see you next time.